working on the problem analysis, and then moving into the conceptual framework. And we will definitely guide you along those steps, because they're quite massive steps in terms of thinking and making decisions about what you prioritize and so on. So now imagine that you've already finished the exercise of the problem analysis and you have moved towards a conceptual framework. Okay, and I said that each of the groups would be working with a conceptual framework where they're able to locate their research questions within the framework. Okay, so a good conceptual framework helps you situate questions at macro, meso, micro, and vice versa. A good research question, you should be able to locate it in the broader picture. So let's talk about what a good research question is, and we're going to end this session looking at some examples of research questions, and I'm going to ask you to decide whether you think they're strong questions or weak questions. As we said before, a good research question is always driven by a problem, a practical problem or an intellectual problem, a theoretical problem. It provides direction in terms of the topic, the approach, the methodology. Sometimes the question also specifies the site, the population, depends on the kinds of questions you're formulating. It sets boundaries very often. So it will specify that your research is taking place in a particular community or with a particular group of people and so on. What's important is that it's clear and it's specific, okay? Very often research questions are weak because the concept is not very clearly operationalized. So somebody says, you know, I want to study tribal women's beliefs and practices about something. And you think to yourself, well, what exactly do they mean by beliefs and practices? Okay, so anything that is a concept or a construct, you have to make sure that you're able to operationalize it later in your methodology. You also need a research question that you can actually address, that's feasible in terms of the time you have, in terms of the access to data, whether it's primary or secondary, but you would not be setting yourself up to set up a research question which you're not able to adequately answer, right? So it helps you to focus the topic and it links the topic to the research strategy, okay? So in terms of the consistency, let's revisit where we started. We started off with thinking about paradigms. Then we moved into theories. Then we go to conceptual frameworks, or we start to analyze the problem. We go to a conceptual framework. We then identify questions that are possible from that conceptual framework. We realize some of those questions are already answered. There's a lot of literature on some questions, and therefore we try to find a question which is relatively novel. Now, novelty depends on at what stage you are in your professional career. You might say for a master's student, it is too tall an order to be novel or original. Yeah, because it's difficult to actually do something that nobody else has ever done before. At a PhD level, you're expected to make a novel contribution. And even if that contribution is very tiny, but it is maybe the population or the strategy that you're using or the formulation of the question which gives it that novelty. And at a senior researcher level, you really are expected to deliver something which is new. Okay, so when you're developing health policy and systems research questions, that one of the things that you're thinking about is it is an applied field. Okay, even though we have been talking about the value and the use of social sciences, including history and geography and political science, ultimately you're trying to shed light on an issue that is of importance to policymakers, program managers, communities. Yeah? And so it's important to think about the overall purpose of the research. What is the research trying to achieve? Why is it being done? Who is it going to be useful for? How will it be useful? And how are you adding to the existing knowledge base? Yeah? So this is about purpose and relevance. Now we're going to look at two important different dimensions of questions. The first is that there are different levels of inquiry. So we're coming back to the macro, meso, micro. And we're reminding ourselves that a macro level analysis often is about looking at the architecture, the overall structure, the macro level structures, the oversight of the systems, the governance of the system, either by national or international guidelines or regulations. But we're also looking at the economics of the system and how that influences different aspects of service delivery and so on. The meso level is focusing on the functioning of the organizations and the systemic interventions. So what happens when the policy trickles down and your facility manager or your district health management team has to put this into place, yeah? What are the dynamics? What is the environment within which the policy is going to land? The policy is never going to land on a blank slate. This is very important to think about. Any kind of intervention that you introduce, whether it's a health workforce intervention, a new diagnostic, a new way of, triaging patients, you're bringing it into a system which already has an existing dynamic, a dynamic that is determined by the culture, the working culture, the leadership culture, but also by simple things like the space you have, yeah? Or is the infrastructure old? Is it new? Does it have new technology, old technology? So when you bring an intervention in, always think about the real world, the real life implications of introducing that. And that's what a lot of health systems and policy research, which I'm interested in, is focused on, is understanding those aspects of space, time, infrastructure within existing facility life, which influence how interventions are taken up. The micro-level analysis is considering the roles of individuals, as we said, providers, users, different kinds of managers. And remember that manager does not equal manager. So you have, in India, I remember this, that in the TB control program, there is such a long hierarchy of different kinds of managers involved in TB control. The STS, the STLS, the this, the this, the this, and so on. So some of them are at the same level and some of them are in charge of each other, etc. But it is quite a complicated system which engenders different kinds of relationships. And those working relationships across those actors are also going to have bearing on people's motivation, how they feel about their workplace, and so on. And so here at the micro level, we're interested in asking questions about how the system shapes and is shaped by their decisions, their behaviors, their actions. So number two, so the first way is thinking about the levels. Yeah, the second way you want to think about your questions is you locate them in terms of the kind of intent or purpose. And by intent or purpose, I mean, what is it that you are trying to do through your research? What are you aiming to uncover? So some research is purely descriptive, okay? Do you remember when we said there are two kinds of problems? Sometimes the problem is just a knowledge gap. And in other situations, a problem is something isn't as it should be, yeah? But the knowledge gap type of problem is where you say, I simply do not know enough about this phenomenon. There's a big gap there, yeah? So your intention is to describe the problem. In quantitative terms, you might say it's a descriptive, cross-sectional type of, I'm going to capture a snapshot of the situation at a given moment. I'm saying who, what, where, how much, how many. Sounds very quantitative. But of course, quantitative research is part of health policy and systems research, right? But you're looking at, use of the system, utilization, uptake of guidelines, whatever that is. But you're describing something about which we don't know yet much. The second type of study actually is close to descriptive. It's exploratory, yeah? But instead of describing, it is when you don't know much about, maybe I should say exploratory comes before descriptive. Because sometimes when you're going into a facility and you want to understand something about the dynamics of managerial culture there, and you're going to conduct a study because you don't know very much. So you need to observe a little bit for some period of time, interview some managers and their subordinates, and you want to get an exploratory sense of what's going on, okay? And then you say, oh, that's something interesting. I've noticed that the culture here of the management practices here are very gendered, or there are, they're hierarchical, but there are ways to bypass this hierarchy, etc. And then you go out and do a descriptive study because you have a sense of the phenomena, the reality that you want to capture, yeah? So exploratory is you don't really know what's going on yet. Yeah, you're just trying to see what could be an interesting topic in this area. Descriptive is you have an idea of what you want to measure, you know there's a gap, and you're going out and documenting that one. And explanatory is when you have an idea of what's happening, you've done a descriptive study, and you have analyzed some of that data, and it is showing up some interesting patterns or some interesting relationships across variables. So, things like we are finding, low utilization of this particular service in this group of people. Okay, what are the reasons for that, right? So you're trying to explain the patterns of low utilization. You're trying to explain the disparities that you see. Yeah. Evaluative is often clubbed up with explanatory, but it is a specific type of question because evaluation relates to a program, an intervention, something that you're introducing. Yeah, because evaluative is obviously trying to evaluate something against a norm, against what it was intended to do. So this is where a realist approach might come in as a form of evaluation. There are many different ways to do an evaluation, but a realist evaluation is a type of evaluative study because you are saying, what are the mechanisms through which this intervention achieves these outcomes under the given circumstances? So that's our second way of distinguishing questions, is the purpose of the study. Here is some examples. Now we're doing like a 2x2 table. So on the left-hand side, we have got the intent of the question, and on the right-hand side, we've got the different levels, okay? Here they've only, in this table, which comes from the reader that you have seen already, the Lucy Gilson reader, we can see that they have clubbed types of questions together. So exploratory and explanatory are clubbed together, normative and evaluative. So normative refers to when you have an idea of what is supposed to be the situation. So you have an intervention which is supposed to improve health worker motivation, or is supposed to improve diagnostic capacity, or is supposed to improve uptake of screening, okay? So normative simply means you as a researcher have an idea of what the ideal performance indicator is. So looking at here, so at the macro level, an example of an exploratory or an exploratory study is, why do informal health markets flourish in areas where publicly provided services are adequate? Okay, it's an exploratory question. Explanatory, what norms underpin the effective exercise of oversight by communities? So you might get confused here because you say, well, what's norms doing in that question? Why isn't it a normative question? But you're not actually doing any evaluation. You're just trying to assess how communities are holding the health system accountable here. Are there ways in which the community participates in some way of giving feedback to the health system? Yeah? Okay, on the meso level, we've got questions like, on the evaluative question, so how can political parties be effectively involved in a country's health planning process for universal health coverage? Okay, so what is normative or evaluative about that? What are you measuring against? universal health coverage. Okay, that's the norm. That is something, a goal, which is set. And you're saying, how are they going to be effectively involved in this process for universal health coverage? So this question assumes that they should be involved, yeah, in universal health coverage. Does a new financing mechanism protect the poorest households from catastrophic costs of accessing care? Again, the normative aspect here is a financial scheme should protect. Yeah, that's normative. In other words, a normative means this is what it is intended to do in the optimal situation. It's intended to protect against catastrophic costs. And so your question is an evaluative question, because you say, in the ideal scenario, my new financing mechanism is going to reduce the number of people who are spending out of pocket. And my research is going to look at whether this is actually the case, or under what circumstances is this the case, and where is it not the case. Can community accountability mechanisms have impact on health outcomes? It's again a type of evaluative question, because the assumption here is that we have introduced accountability mechanisms, for example, user feedback, suggestion boxes, things like that, where you have some way that the community feeds back their experiences of the health system. And we're going to now evaluate whether these are making a difference. Okay? Okay, in terms of the meso level, how can access to and uptake of screening and treatment programs for an epidemic condition be maximized? Again, often these questions, normative, evaluative, are implicitly talking about something that's been introduced, either a policy, a guideline, or an intervention. And here there's an intervention, right? There's an intervention which is a screening and treatment program. What are the reasons for how low efficiency of community governance structures in administering a decentralized fund scheme? Again, you're evaluating the community governance structures. Okay. Right, anything else? Let's just go to the micro level and go down again. So micro level exploratory. How do frontline health providers why do frontline health providers frequently diverge from recommended clinical guidelines? Now this is an interesting one. Some of you might say that sounds evaluative to me, because I have the norm, the standard, which is the recommended clinical guidelines, and I'm trying to understand why people diverge from that. So I personally would have put this in the evaluative category. I think the question, if you had asked it differently, for example, if you said, in what ways do frontline providers diverge from recommended clinical guidelines, that's a more descriptive question. But when you say why do they diverge, it's explanatory, but it's also evaluative. Okay. Okay, so this will take time to sink in, but don't worry, because what you're probably realizing is you get the input, you need to sleep on it, and then it'll become clear the next day again. Okay? But essentially, so we've already understood these are the two ways to think about questions. Situate them at a given level, and also clarify the purpose or the intent of the question. The third point is the question of whether your research question is touching on the whole field or a specific policy. So is the research focusing on the field as a whole, and will it expand knowledge of the nature and functioning of key elements of health policy and systems, or is it focusing on a particular policy that which will support its implementation? So when we talk about field as a whole, we might say there might be questions which is, how do countries' health financing mechanisms impact on the efficiency of the system? And you do a comparison of 16 countries. Okay? You're going to contribute to the field as a whole of understanding the relationship between health financing and performance of the system. But if you go into a specific policy and you say, in India, how do the latest budget reforms impact on the maternal health program? That's more specific because it will also most likely have relevance just for the Indian context. Okay? Okay, so this is, again, to distinguish questions about the policy or questions about the field, right? And again, they're distinguishing here, they've clubbed together. Don't worry so much about the way they're clubbing. I think they were just trying to save space in the reader. So questions about a specific policy. Should this policy be adopted? How does policy X impact on health-seeking behavior? What actor management strategies are likely to be the most useful in supporting implementation, and so on? On the descriptive side, explanatory side, which agencies are stakeholders in this policy? What positions do they take? How did the policy come about? Is there capacity to implement it? And so on. And when we move into the broader questions that are relevant to the field, you'll see that the questions are pitched much more broadly. What type of health systems performs best? That's a huge question. Can you imagine the kind of analysis that would need to be undertaken to answer that question? Yeah? What are the different approaches to actor management that can be considered by those seeking to manage policy change? So what they mean by actor management is the control knobs, yeah? Issues of regulation, incentivization, and so on. So how do I introduce policies that will influence provider behavior, that may or may not bring about better policy implementation? And on the last field, we have what are patterns of health-seeking behavior? What influences that behavior? How is the health system organized at present? What if a new provider was available? How would health-seeking behavior change? I think these are also broader questions because they're not specific to a setting. Yeah, but you're saying usually these are studies that involve multiple countries, and often, a bigger research proposal is a comparative research proposal because you want to contribute to the field more broadly. You want the research to be generalizable across different settings. Okay, now there are some very helpful frameworks, okay, for formulating research questions, and you may be familiar with these already. So there's lots of them, and I'm going to provide you with a link that shows you different frameworks. But one of them is called Peacock, yeah? And basically, it reminds you that if you formulate a question according to the Peacock framework, you need to focus on the P, which is what is the person, population, or problem? Who or what is the focus of the research? Okay, so it might be the case of people. Why? Because your research wants to target, your HPSR research is looking at a specific population, managers or people affected by a certain condition that are experiencing issues with the system. Or you might have a broader population, so people attending outpatient services. Or you might have a specific problem. So what is the focus of the research? The second is, and this is why this kind of frame works for intervention research, is what is the intervention that's being investigated? But remember we said that an intervention can be broadly thought of, yeah? It's not just introducing a new drug or introducing a new screening mechanism. The intervention can be the policy or the new, we put in a community health officer. Okay, that's an intervention because we think that it's going to solve some issue in the health system. Okay, we put in new trauma care units. That's an intervention. So think about intervention broadly. Comparison, what intervention is this being compared with, if any? Outcome, what are the effects of the intervention? And context, in what context or place is the problem being investigated? So these are just things that you might remember when you formulate your question that's derived from the conceptual framework, is the level of specificity is quite important. So rather than saying something like, why do people, what drives, health seeking for trauma centers, or what drives delays. You want to be as specific as you can. You want to say, okay, what influences delays of this category of people in reaching this facility within a specific amount of time, etc. Okay, so specificity is quite important. This is another kind of framework. It's called SPICE. So this one focuses on the setting, the perspective, whose perspective is being researched. Again, the intervention or the area of interest, the comparison, if there is any. I'm not saying every question has comparison, right? Because sometimes the question is purely descriptive. And the evaluation, so what are the outcomes? So I wouldn't worry too much about this because there's lots and lots of these kind of frameworks, but they're all more or less covering the same things. Some are better for evaluative questions, and some are better for explanatory, and some are better for descriptive ones. Okay, so this is the exercise that we will be doing tomorrow, which is that you will go through this journey from the problem analysis to the conceptual framework, and then you're going to try to locate questions in each of these boxes, which is not easy. It's going to be hard. I can say that already. So be well equipped in terms of energy and enthusiasm, because this one is a tough exercise. But we will get there, I promise you. Okay, everybody gets there. Okay, so we're going to wrap up from today's session overall, and I think we're just wrapping up with the points from some of yesterday's sessions as well before we look at some research questions. So research is driven by a problem, but conceptual frameworks are neutral. A conceptual framework is not the problem analysis, it's the next step. The conceptual framework conceptualizes relationships and pathways to explain an issue, and it's important to think about the indirect and the direct influences. There's a difference between theory and conceptual framework, okay? A theory might drive a conceptual framework, but you could have multiple theoretical influences on a conceptual framework. There's different ways to develop and formulate questions, and we've given you a sense of the level, the purpose, and then we've also thought about some of the frameworks, the type of specificity that's needed. We will go into developing a conceptual framework in practice more, but I've already started to outline the steps that you're going to take. And then I've also shared with you, based on that image, which I hope sticks with you, because often the visual sticks with you, of the lady health workers in Bangladesh, that you can use different theoretical lenses for the same setting. And I think that's what's very, very exciting, because I'm sure that you do that as master's students here, is often you have the opportunity to be attached to one single project or one program, but you've got to come up with different questions, yeah? So often those questions are really influenced by your lenses. Okay, so now we're going to move into a little bit of interaction again. And I think we can keep the camera on, that's fine for these points. I want you to look at these questions, and I want you to tell me whether they're good questions, okay questions, or poor questions. And I want you to tell me why, all right? So question 1, what are the main structural and social factors influencing access to TB treatment among Eastern European migrants with tuberculosis in the United Kingdom? How would you rank this question? Do you think this question sounds okay as a research question? It's a good question. Okay. Yep. Yeah. Yeah.
I think main structural and social factor is big broad. That can be narrowed down.
Good. Okay, very nice. Anything else? Any other table want to agree or dissent? Okay, good. So the question is, can you do both? Can you do structural and social? I think you probably can, because when you talk to people, they don't divide it. They're talking about poverty. You're not going to say, no, I don't want to hear about your poverty. I just want to hear about your social issues, right? They're going to speak to you about many things that affect their treatment, and but it's a good point, whether you put that already in the question, yeah? Okay, but in general, we would agree that the first one is not bad, right? We would give it, what would you give it out of 10? 6? Ooh, you're very harsh on this side. 9, okay, that's better. 8, okay, good. All right. Okay, what about the next one? What are adolescent girls' experience of family planning services in India? No, not good? Okay, why don't you like it?
I think the so family planning services, the target population may be like, I think adolescent girls may or may not fit
Okay, good.
the definition.
So it doesn't seem the right fit for the country setting, but what
Yeah.
else is going on here? Anybody else from that table?
Like it can be put like this: what are the family planning services available for reproductive age group women in India? We can put like that.
Okay, but you're changing the question into a descriptive question. So I want the question to stay as is, but I want you to tell me what's wrong with it. What is missing in terms of specificity? What could be added to make it more specific?
Like what kind of family planning services we
Good.
are?
Yes, exactly. What type of family planning services? Yeah. Are we talking about? It's interesting that you raised this issue that this isn't probably the question that would be work here, because nobody in other classes notices that, because this is a question that is acceptable. Adolescent girls from a certain age might be involved in sexual activity, and therefore we need to think about family or contraceptive services, right? So the issue is a very good question. You're saying, what do we mean by family planning services? What else? What else needs to be operationalized here? Something very basic. Sorry?
The age group of the target
Exactly.
population.
Is an adolescent girl 15 to 19? Are they 12 to 19? Are they what do we mean by adolescent girls? Yeah? And another thing that needs to be broken down.
Probably the experiences also in terms of saying utility of the family planning services, or in terms of the validity of the family planning services. This.
I'm not so worried about that, because I think that if you're coming from a relativist point of view, you just want to understand their experiences, but your point is taken. Is it use of the services, or is it getting to the service, or is it knowledge? Not quite sure. It could be all of the above. Yeah? But the other issue is India. I mean, for goodness sake, India, the whole country? Right? So you would expect, because every state is so different, that I would have expected to see this broken down, unless you're really going to do this study across the whole country. Yeah? Okay. So how would you rank this one out of 10? 5 or 6? 6. Okay. This one's being a little more generous. And you're giving it 5 or 4. Oof. Wow. Okay. I'll know not to submit a proposal to you. Okay. What about this one? Does the fast food industry affect the rise of non-communicable diseases in Ghana? What is good about this and what is not so good? Interesting question or not?
When they are talking about NCD,
Yeah.
I think exactly. I mean, NCD is an umbrella term.
Yeah.
So which ones are they focusing
Good.
on? And
Yeah.
that way.
What else needs to be operationalized?
What kind of fast
industry.
food?
Yeah. Good. Okay. What else?
The country.
Country's okay here. Go ahead. Yeah.
The question is directly give you an answer of either yes or no. does the fast food industry affect the rise? It's yes or no?
Absolutely. It's a spoon feeding question.
Yes.
Does it influence? It's already kind of pushing it in a certain direction. Yes, no. Yeah? So how would you reformulate it? Go ahead.
Probably I'll start with how the fast food industry affect and
Okay, how, in what ways, to what extent? Yeah? Okay, good. Okay, next one. What forms of evidence drive health policy in the context of post-conflict health sector rehabilitation in Sierra Leone, and how? Is this one specific? Yeah, nodding. What do you think? Table over there. Do you like this question? No? Okay. Oh, that's sad.
Like the question is saying like what forms of evidence drive health policies in context of post-conflict health sector rehabilitation in and how, but we are not telling like before that we can look like is there any evidence? Is
Good.
there any evidence?
Very nice point. This assumes that there is evidence that drives health policy, right?
Yeah.
Very good. So I don't think this is a bad question, because you might end up with the research saying very limited evidence drives policy. But you're right to say that this assumes that evidence is driving policy. Okay, anything else about this question? Is it specific enough with regards to the framing? Yeah? What would you give it out of 10? Anybody? Less than 5? More than 5? 7? Yeah, that seems reasonable. I think it's a decent question. Yeah? What about this one? How did the Global Fund skew health systems delivery in Southern Africa? Too big? My thing is going to run out in a minute. Too broad, yeah? Time period, good. Excellent. Time period, what else?
What kind of health systems?
Okay. What does skewing mean? Yeah? Skewing is a bit vague, right? Health systems delivery is also huge. Maternal health services, all health services, yeah? Okay, so this one I would give a 5 max, yeah? The last one is how do health workers, why do health workers fail to comply with ethical guidelines for HIV testing during ANC? What is, I'm going to say this is problematic already. Why is it problematic?
The location, the studies.
Location is missing.
Setting
and
is missing.
health worker type, yeah, and?
Guidelines of,
Guidelines are okay. That's okay. What is this? What is this assuming? What is the question assuming?
Yeah. The assumption of failure, maybe. Assumption of failure.
Assumption of failure, exactly. Yeah, excellent. Okay, so this question is also shaped already in a way that is negative, right? It is assuming health workers fail to comply. Okay, so we should try to reframe it in a more neutral manner. So, how do health workers respond or take up guidelines for HIV testing? That's descriptive. But maybe we've already done that study and we're seeing that they do fail to comply. And therefore we're asking, why do they not adhere? But fail is a bit of a harsh word. Okay? Okay, good.
Ma'am, in point number 5 question,
Yeah.
I think the researcher is trying to be neutral while writing the word skew, can go either positive or the negative.
negative.
If not, then what is the better word to use here?
I think if you want to be completely neutral, you could say, how did distribution of the funds through the Global Fund, or how did allocation through the Global Fund affect health systems delivery of services for this program in Malawi or Zambia? Southern Africa is also massive. Okay? But on the other hand, none of these questions are terrible, yeah? Because question number 5 could be a broad study. And they specify we're looking at Zambia, Malawi, and South Africa. Okay, good. So we're going to stop there. We're going to break, and we will stop the recording. So thank you very much.